Hi, I thought I'd just come and see everybody today and give you a little bit of education about lung and rib cage anatomy and function so that we can all try and keep our respiratory systems as high functioning as we can whilst we're all sort of self-isolating or limiting our interaction with people. Some people might be getting out for a run and getting that deep cardiovascular exercise. Some people may just be going for a little walk where they're not really using their full capacity of their lungs. So when you're sitting at home, it's really good to just check in with your lungs and your respiratory system every now and again and really make sure your lung capacity is being used to its maximum ability. We're going to go through some anatomy first because I've got some lovely illustrations here. So first of all, I want you to think about the anatomy of your rib cage and this really important muscle that sits at the base of your rib cage. This muscle is called the diaphragm, and it has a central tendon, and then it inserts in around the back of the rib cage, around the bottom ribs, and down into the lower back. And this muscle is designed that when you breathe in, it sits up in a dome inside your ribs. As you breathe in, it contracts and flattens and pulls down in towards its insertions, and then as you breathe out, it domes back up inside the ribs. As you breathe in, it contracts and flattens, and as you breathe out, it domes back up. And its job is to give you more space inside the rib cage for the lungs to expand and pull more air down into the lungs. You've then also got the two layers of muscles in between the ribs. So you have your internal and your external intercostal muscles, which sit in between the ribs and help with your rib expansion. So we're going to go and have a look at some of those movements in a minute, but then I just want to show you in and underneath the ribs so you can see what's happening underneath there. So the next layer, deeper layer, is where we have our pleura, which are these big sacs. They are lubricated with a fluid-like substance which allows them to move inside the rib cage and slide on the internal walls. And then within these pleural sacs, you have your actual lung tissue. On the right side, your lung is divided into three lobes: a superior lobe, a middle lobe, and a lower lobe. And then you've got, on the left, you have just a superior lobe and an inferior or lower lobe. And in the centre here, sitting towards that left-hand side, is your heart, which takes up that space on the left, so you've only got the two lobes. Then you can also see the nasal cavity here. Now, this is really important at this point in time. If you are a mouth breather, you are completely bypassing the filtration system of our lungs. The filtration system to prepare air to enter the lungs is through this nasal cavity, where air spirals in through there and particulates, sort of any dust or viruses and anything like that, is hopefully filtered out. The air is humidified and brought up to a temperature that makes it less of a shock when it goes down into the lungs. So that area there, the spiralling of air coming in through the nasal cavity, prepares the air, humidifies, warms it up and filters it before it then enters the lungs. If you're bypassing that system, you're sending air down into the lungs which hasn't been humidified, hasn't been warmed up, hasn't been filtered. So when you breathe in your mouth, it's not as nice for you, not as nice for your lungs. So one of the most important things is to try and practice breathing in and out through your nose rather than through your mouth. If you are normally a mouth breather and you find going from a large hole to breathe in, which makes the air feel like it hasn't got a lot of resistance to breathe in, if it suddenly feels difficult to breathe in through your nose, visualize the air spiraling in through your nostrils and make the breath slow and long so you're not trying to force the air in. So if you just pull it in gently and slowly and imagine it spiraling, it has time to filter through the nasal cavity and warm up, humidify and filter before it then pulls down through into the lungs. If you're trying to do short, shallow breaths, it will feel much more difficult to breathe in through the nose. So the way you breathe will make it feel different. So sometimes you have to retrain your natural way you breathe in order to make it feel better for you. So you're filtering the air in and out through your nose firstly. So you're breathing slowly in and out. And then the next thing you want to notice is whether you're breathing up here or down here. So if you place a hand on your breastbone and a hand on your belly and breathe, I want you to notice which hand is moving the most. If this hand is the one with the most feeling of movement, it means you're an apical breather and you're breathing up into the top of your lungs. If this hand, the bottom hand, is moving the most, it means that your diaphragm is working, which should be your primary breathing muscle. That's where your air should be being pulled from. It should be pulled down into the bottom of the lungs by this diaphragm contracting. And therefore, it's less effort to breathe. If you're breathing all up here, you're using all these neck muscles, which are your accessory breathing muscles, which are designed to only be used when you really need that extra bit of breath to fill your lungs right to the top. And therefore, if you're using those all the time, you're putting yourself into this heightened state of sort of respiratory effort, and you shouldn't need to put that effort in for normal relaxed breathing. So if this hand is moving more than this hand, you want to change the way you breathe. You want to make this hand calm down and stay nice and quiet, and you want to pull the air down into the bottom, into your belly, into the bottom of the lungs, using your breath, thinking of filling into your hand. So you want to breathe in, and your hand on your belly should move out, and then breathe out and it relax in. The reason this hand is moving in and out as you breathe is because this diaphragm is contracting down. As it contracts down, it will push your abdominal contents slightly forwards, which will give you that sense of breathing into your belly. And then as it recoils back up, the belly can go back to its resting position. So you're breathing in and it's contracting down, and as you breathe out, it recoils back up. And that's where your breathing should happen. And that pulls the air all the way down into your lower lobes and stops you breathing apically, where you can sort of heighten anxiety if you breathe up here. So if you're stuck breathing up here, you'll be stimulating your sympathetic nervous system, which is your fight or flight response system, and therefore you can feel more agitated and more anxious, and you can often get those slightly panicky feelings. If you can change your breathing to bring it down into the lower belly and diaphragm, you will start to stimulate your parasympathetic nervous system. And to stimulate that even more, you want to make your in-breath, maybe start off with a count of 3 for your in-breath, and then breathe out for 2 counts longer. So make your out-breath about 5. So breathe out for 5. Start breathing in for 3 and breathing out for 5. If you can keep making each breath slightly longer, so then you breathe in for 4 and out for 6, and then in for 5 and out for 7, you're slowly building up that time, that slow, deep breathing down into the bottom of your lungs. And ultimately, you want to try and aim to breathe in for a count of 7 and out for a count of 11, which is 4 counts longer than your in-breath. And that will really help stimulate your parasympathetic nervous system, which is your rest and digest nervous system, which is what you need to be stimulating to allow the body to heal and rest and recover from any activities you've been doing. Or if you've got an infection of any sort, that rest and restore breath is really important to help you heal. So the primary muscle is that diaphragm, pulling the air down into the bottom and feeling that belly moving out and back in and keeping your breastbone nice and heavy. The second group that you want to exercise is those intercostal muscles, which help with the rib expansion. And the ribs move, or should move, and some people can get very stiff rib cages if they sit at desks a lot and they're not doing a lot of cardiovascular exercise. You have a breastbone at the front underneath here. This is your breastbone. And then at the back you've got your spine. The ribs attach at the spine and at the front at the breastbone. And there's an action called the bucket handle action of the ribs, where they hang down a bit like the handle on the side of a bucket. And then you can breathe in and the ribs can widen out to the sides towards your arms and then back out. So as you breathe in, the ribs will go up and out, and then as you breathe out, they'll drop back down and in. So breathing in and breathing out. And to feel that, we move the hands from the breastbone and belly onto the sides of the rib cage. Depending on your shoulder movement, you can either put your hands here or you can cross your arms and put the hands around the sides of your body. If you've got them, I'm going to use them here so you can see. If I start with my fingertips together and my thumbs are hooked around my ribs, as I breathe in to the sides of my rib cage, you can see my fingers apart. Breathing out. Breathing in. And breathing out. And breathing in. And breathing out. So you're trying to get that lateral expansion, and I want you to just practice. If you find that really difficult to feel the ribs moving out, so if your arms are down by your sides, your ribs are widening towards your arm bones. And another area you can feel is the back, the lower part of your rib cage towards the upper part of your lower back. If you put your hands there, as you breathe in that bucket handle lateral breath, you should feel that area expanding too. And that'll be a combination of your rib action and your diaphragm action. So for normal rest breath, your diaphragm will be doing most of the work. To increase your breath, as you start to take wider, deeper breaths, you will add that bucket handle rib action. And everything up here should want to stay relaxed and calm. You're not adding in this fight or flight accessory breathing at this point. You're just allowing the air to be drawn right down into the bases of the lungs where it needs to be, rather than pulling it up in just to the top of the less sort of useful area at the top. So you're really wanting to practice that breath, really practicing lengthening the in-breath and the out-breath, aiming to build up, and it might take you time, days, weeks or whatever. If your breath is struggling to do 3 to 5, it might take you weeks to get to 7 to 11, depending on how much you practice and how much rib movement you've got. If you've got a really stiff, fixed rib cage, it might take you longer. The other thing to remember is with your ribs, sometimes they can be stuck slightly out in that slightly raised position. So it's as important to get that full out breath before you get the full in breath. So often with asthmatics, they will get stuck with almost slightly hyperinflated lungs. Therefore, when they feel like they can't breathe, it's actually because their lungs are already slightly overinflated, and therefore it's more about getting the breath all the way out before they then try to bring the air back in again. So both parts of the breath, the out breath is as important as the in breath, and it's the same with the diaphragm. You want to really get that out breath so the diaphragm recoils back up in, so then when it contracts and pulls down, it pulls lots of fresh air all the way back down into the bottom of your lungs. So practicing that. Then we're going to do some ribcage mobility stuff, and I'm going to use some of Eric Franklin's work. He does a lot. If you Google him or put him on YouTube, you'll find lots of his videos on anatomical visualization to help you move. The first visualization of his we're going to do is using the lobes of the lung. So these are my visualizations of the lobes, and as you can see, these lobes will literally move all over because they're surrounded by fluid. They can move, they're lubricated, so they should be nice and easy to move. You've got your 3 on the right hand side. On your left you have 2 with your heart snug in the middle there on that slightly central part. And what I'm wanting you to visualize is those lobes in your rib cage inside it, and they're going to help you move and inflate your ribs. So you're going to put your left hand around the side of your rib cage. If you've got good shoulder mobility, you're going to reach your arm up. If you haven't, just rest it across the other side of your shoulder, wherever it feels comfortable if you've got a shoulder problem. Otherwise, you're going to reach it up and you're going to breathe in, and as you breathe in, you're going to side bend over, visualizing those lobes of the lung filling and sliding over each other and then sliding as they deflate back. Breathing in, they're filling up and side bending, and breathing out as they deflate to come back. So you're keeping going, breathing into your hand and breathing out. And last time, breathing in and breathing out. And then we're going to do exactly the same on the other side, except you've got your 2 lobes with your heart in the middle, and you're going to either have your arm up or across, depending what's comfortable for you. And you're going to breathe into this hand, filling up those lobes of the lung, letting them slide over each other, and then breathing out. And breathing in and breathing out. And breathing in. If you know you've got a disc problem or some osteoporosis, please don't push yourself with these movements. Just move gently. Breathing in and breathing out and releasing down. And then we're going to do one other exercise with the thinking about the lobes, which is going to be flexing the spine and extending the spine. So you're moving the spine forwards. So if I sit sideways on, you're going to go forwards and round the back, and then you're going to lift the breastbone up to the sky. And you're visualizing, again, these lobes are going to slide forwards, and then they're going to slide back, and they're going to slide forwards, and they're going to slide back. And you're breathing out as you go forwards. So breathing out as you round forwards, and then breathe in, fill those lobes up, inflate them as you lift your breastbone to the sky. And breathe out as you go forwards, deflating the lungs. Breathe in, fill those lungs full of air. And breathing out, deflate. Breathe in, fill them to the sky. And one more, breathing out, deflate the lungs. And breathing in, lift the lungs to the sky. And then coming back to rest. Then the other muscle, so that's just worked a little bit of mobility through that rib cage and just loosened you up a little bit, hopefully. And then we want to just stretch the diaphragm. When you breathe out, the diaphragm recoils back up, and that's when it's in that shortened position. When it's in that recoiled rest position, it's when you can stretch some of the insertions that attach down into the back and down through the back of your ribs. So we're going to use the same movement we've just done, but we're going to use the out breath instead of the in breath as we move, and you're going to try and feel that deep stretch deep into the back, down into the back of you. So you're going to have a hand over the right side of the ribs. You're going to take that arm up or across, depending where your shoulder's doing, and you're going to take a breath in to start, and then you're going to breathe out all the way through that movement. Keep breathing out, breathing out, breathing out, breathing out. And you might find a stretching sensation down through the back of the rib cage and into here. And then breathe in to come back up. Breathing out, keep breathing out, breathing out, breathing out, breathing out. Deflate those lungs, deflate them. And then breathe in, fill them up. Breathe out, deflate those lungs, deflate them. Let that diaphragm come back up inside the rib cage, and you're stretching that diaphragm. And then breathe in and it will drop down. Breathe out, that diaphragm's recoiling and you're stretching it. And then breathe in as it comes back down. Going to do the same on the other side. Hand round the side of the ribs, either arm across or arm up. And you're going to take a breath to prepare. You're going to breathe out, out, out. Keep breathing out to stretch that diaphragm, and breathe in to come back up. So as you breathe out, the diaphragm is recoiling up inside the rib cage and you're stretching it, and then as you breathe in, it'll drop back down. And breathe out, it's lifting up inside the rib cage and you're stretching it. And then breathe in to drop it down. Breathing out, stretching that diaphragm up inside the rib cage. Push the air all the way out at the end there, and breathe in. And breathe out. Diaphragm pushing all the way up inside the rib cage, and breathe in to come back up. Now just find that rest breath again, breathing down into your belly, and then add that lateral expansion and do your counting, and notice if the ribs feel a little bit more mobile, a little bit more, you can get a little bit more air into the rib cage. You've made a little bit more space, so you can hopefully breathe in for slightly longer and out for slightly longer as well. So you might be getting nearer that 7-11 restorative breath pattern. Have a go at those things. Hopefully that might be helpful, give you something to do to exercise your ribs. You can do that. You can do 2 or 3 breaths every hour if you want to during the day, just to really make sure you're keeping your lungs healthy and using the maximum space you've got inside that rib cage whilst you're at home, maybe trying to cope with children and homeschooling. All right, good luck with it. Cheers, bye.